The Real Meal Revolution is not your average cookbook. It sold 10,000 copies in just 4 weeks and remained the best-selling book in South Africa for over 10. One of its authors, Professor Tim Noakes, has been outspoken in promoting a fundamental change to our diet. He's going against the grain, so to speak, and encouraging us to limit our intake of carbohydrates and to replace them with fat.
What if everything we know about a healthy diet is wrong? That's exactly what Tim Noakes is proposing with his Real Meal Revolution, and he's winning converts by the hour.
A low carbohydrate diet has traditionally been recommended for diabetics, while fat has been all but excluded from most diets. Hello Doctors, Andy Milne has put this new diet to the test.
And you're not a diabetic, you're not even a pre-diabetic, so what made you want to go on this particular diet?
I think the biggest thing about wanting to do the diet was I'm a tinkerer by nature, so I try loads of diets the whole time. I do want to lose weight, even though everyone says I shouldn't, but this one has taken South Africa by storm. I wanted to test it for myself.
And what's the experience been like?
Yeah, we did properly. So we wanted to do 100 days, and probably the most significant thing I've found in the diet is understanding how significant the no or very, very low carb to fat is, has been absolutely enlightening. Exercising brilliantly, sleeping better, got energy. I mean, I feel absolutely fantastic.
Professor Noakes has spent the past 30 years challenging our beliefs about everything from hydration to fatigue. But his attempt to revolutionize the way we eat is set to be his greatest challenge yet. With 1/3 of all adults worldwide now classified as overweight or obese, finding a sustainable way of losing weight and improving health has never been more important.
Tim, your foundation's website's got a provocative question right up front, and it's simply this: what if everything you know about a healthy diet is wrong? And I'm assuming you're saying it is.
Absolutely. We were doing very well until 1977, when for political, commercial, industrial reasons, the United States changed the dietary guidelines and said we should remove fat from the diet and replace it with cereals and grains. And that completely changed the way humans were eating. And they were told at the time that it's speculative what you are doing. There's no scientific evidence for this. And people predicted that we would get fat as a consequence. And the obesity diabetes epidemic begins in 1980, not in 1970, not in 1960, in 1980, 3 years after the guidelines changed, and no one will take responsibility for that.
So the age-old belief that fat causes fat is not true. What you're saying is sugar, carbohydrates cause fat.
Carbohydrates, and we've known that since the 1800s, and every farmer knows that. You make cattle fat by feeding them corn, i.e. carbohydrate, not by feeding them fat. And humans are exactly the same. The mechanism is perhaps a little more complex, and people understand that if you eat carbohydrates, you will overconsume calories, because carbohydrates drive hunger, they don't satiate you. Whereas fat and protein, although they have, particularly fat, has more calories per gram, it's more satiating.
And he's done really well on the Banting diet. He's lost weight, he's in great shape, he's got great energy, but his bad cholesterol, his LDL, has really skyrocketed. So is that dangerous? Is that a risk factor for heart disease in Andy's case?
The basis for this theory that cholesterol causes heart disease is you eat a high-fat diet, your cholesterol goes up, and that clogs your coronary arteries. So now the first thing you want to do, if you have a hypothesis, is to test it. So what you do is you go and look at a population and you measure the cholesterol in the blood and you look at their arteries. And we now have a method of looking at arteries, and where we don't have to invade the patient. We can take a scan of the heart and measure the calcium content. And that, incidentally, is the best predictor of your heart attack risk, is the calcium score in your arteries. Numerous studies, in fact 12 studies have been done using that technique or a related technique, and they've shown, and I repeat this slowly, there is no relationship between your blood cholesterol or your total cholesterol or your LDL cholesterol and the state of your coronary arteries.
Let's dig a little deeper into LDL, bad cholesterol. There are studies to show that LDL is part of the process of atherosclerosis, of plaque forming, of inflammation in the arteries.
It is true that a raised LDL cholesterol predicts future risk of heart attack by about 30%. But now that is an associational study. It does not prove causation. The problem was then along came the statin drugs, and they said, okay, if we drop your cholesterol, then we will reduce your heart attack risk. The problem with those studies is they are all confounded and there are many problems to them. And the effect of statins is so small. It is so small that it doesn't exist in many studies, and those studies are never reported. There's never been a study that nutritionally reducing your cholesterol will reduce your heart attack rate. There's none. What we know now is that it's lipoproteins which are linked to heart disease, not cholesterol, because cholesterol in blood doesn't exist. It exists in a package, and that is the lipoproteins. LDL cholesterol, which you said the bad cholesterol, we now divide into a good bad cholesterol and a bad cholesterol, because that's how confusing the terminology is. The bad cholesterol are the small, dense LDL particles. The good bad cholesterol is the large, fluffy LDL particles, which have no way, absolutely no way of getting into a coronary artery. They cannot pierce the artery. Even if the artery is damaged, they can't pierce it. What happens on a high carbohydrate diet is you make more of the bad cholesterol, and then you oxidize them because you're smoking, or you've got hypertension, or you've got inflammatory response, or you've got diabetes. And by the way, diabetes increases your risk of heart disease higher than anything that we know about. So when we get back to Andy Milne's experience, he is the 1/3 of patients who show a raise in LDL cholesterol on this diet. We predict that most of that raise will be because of an increase in the large, fluffy LDL particles, which are completely benign. And we'd also predict if his HDL cholesterol has gone up and his triglycerides have gone down, that tells us that more of the small, dense LDL particles have converted to the big, fluffy LDL particles.
Refined carbohydrates appear to be one of the biggest culprits in raising triglycerides, which are the main vehicle in which fat is transported and stored.
So you're saying to reduce our cholesterol, we need to consume more fat. I love the irony.
Correct. If we talk in the old terms, bad cholesterol, good cholesterol, we can lower your LDL cholesterol by putting you on a vegetarian type diet, low fat and low protein diet, but it will drop a little bit. But the problem is you get an increase in your triglycerides and you get a reduction in your HDLs. And that's because we've converted the bad LDL cholesterol into the bad cholesterol. We made them all the small dense LDL particles. And that was not realized when this first research was done on the sort of vegetarian type diet. Everyone said, oh, it's great, because they only looked at LDL cholesterol. And they didn't understand what was happening to the components of the LDL or the HDL and the triglycerides. And there are many people who believe triglycerides are probably the better predictor of heart attack risk in the long term. You do not want high triglycerides. And they are caused by insulin resistance and a high carbohydrate diet. And that's the problem. Take the fat out the diet, replace it with carbohydrate, you worsen the cholesterol profile.
Apart from cholesterol, the other risks associated with a diet very high in carbohydrates includes obesity, diabetes, and even a decline in brain health.
In challenging our foundational beliefs about what constitutes a healthy diet, Tim Noakes has divided us. We have the camp of Noakes and Banting evangelists in one corner, and we have those that think it's a fad or call it quackery in the other. But what Tim has done for all of us is gotten us to think about what we're eating and what constitutes a healthy diet for me. And that is a great legacy.